Doc Ken Hartigan-Go emphasized that the hackathon is really a chance for you, a sandbox basically, to express your creativity, to express your innovation. You will be challenged to look at things in a new way and to find a different solution for it, an innovation for it.
This is best described yung ating governance innovation report as applied research. Hindi siya full thesis. These are practical solutions to public issues or problems. Because we are solving a public issue, it should be problem-oriented. Yung very realistic yung trust ng ating mga recommendation. I know that you have been given a lot of tools on analyzing our stakeholders.
Yes, mag-set up na tayo. That's also my recommendation to our executive committee and the hospital. Let's set up an AHDP. Let's start doing this. Let's make our hospital adolescent-friendly because they have so many health needs. Many of their health needs are unique to their age group. We have to address them.
If we do not know who the people we are serving, how will we be able to advocate for equitable, quality, effective, efficient healthcare for better health for all Filipinos? That if we do not monitor primary healthcare progress, being monitored on a regular basis, this will actually help us build more resilient healthcare systems that are closer to the people that we serve for better health outcomes. As I said, quality, equity, and better health for all Filipinos.
We have started professionalizing our public health profession at yung mga ginagawa natin ngayon in terms of public health. And this kind of activities and this kind of learnings raises the bar furthermore. And that is really heartwarming and nakaka-proud na ngayon it is at the heart and at the center of what government does and how the healthcare sector works.
So why is there no increase in prenatal status rate? Why does home delivery still exist? Why is MMR still high? Despite the significant progress in recent years, there are still unmet SDGs in the Philippines. Various studies already listed several factors that influences prenatal completeness and home delivery, and these factors have already been addressed. So what more can we do to be proactive in preventive medicine? How do we encourage more women to deliver in the health facility? Should we wait for another home delivery? Or worse, another maternal mortality? So let's act now. Introducing Kuhit, from a Bisaya word which means to nudge or to call the attention of someone. Kuhit app is a real-time and intensified prenatal monitoring and an app-to-paper reporting. Kuhit app ensures an up-to-date tracking of midwives by having a census per prenatal day, which can be utilized to capacitate PHWs in monitoring pregnant women and immediate determination of risk category, resulting to better maternal and child health outcomes. Until we can track who is being left behind, health for all will remain an empty promise. So this is what Kuhit app wants. So, let's start now, and no one should be left behind. With that, thank you.
How come we are part of this health system, yet we as doctors have very little information and have difficulty in navigating through the health system? This is very problematic because for us doctors who are already finding it difficult, what more for the patients who are more often than not left to their own devices? Doc, saan ko po ito pwedeng ipagawa? Magkano po ito? At kailan po ako pupunta? To which we reply, Ma'am, hindi po kami sigurado. So it is this information asymmetry that is pervasive across the entire health system. Wouldn't it be nice to have all these information within our grasp? We have a simple solution to take the guesswork out of the difficulties surrounding outpatient-provider choice. Ladies and gentlemen, friends, we bring to you MedDirect. MedDirect is a web-based navigation application that tells us all we need to know about outpatient health services, diagnostic, and laboratory services. This app will allow to compare the cost, the distance, and the schedules among the different health, public and private providers. And this is accessible for both doctors and patients.
We all know that our country has a fragmented healthcare system where the private institutions and actors operate independently from the public. There is a disconnect even between government facilities themselves and those between the private sectors. Do you know all the specialists in your area? Do you know where their clinics and their schedules are? Do you know what happened to the patients you referred? For some of us, the most common answer to our patients' questions would be, "Sorry po Nay, bago pa kasi ako dito, wala akong kilala." This is a big problem to our patients who rely on us, their primary care providers, to direct them to the appropriate institutions who can meet their particular needs. We are proud to present Connect the Doc, your primary care connection. Connect the Doc is a digital physician registry, networking, and referral system made by doctors for doctors. It allows physicians across the country's geographical boundaries and across specialties to create connections within the healthcare provider network. Connect the Doc aims to strengthen the primary care provider's gatekeeping function, not only facilitating patient referral to higher care, but also streamlining down referral to protect patients from financial catastrophe. We are dreaming of a future where we can give better answers to our patients, where doctors are connected, and where primary care means access to optimal healthcare. Nangangarap din kami na masasagot na namin ang mga katanungan ng pasyenteng Pilipino.
Doc Adadayon, agad-agad ng aksyon is a 24/7 messenger-based health chatbot for GIDA communities in a local language. No need to download any other app if you are currently an FB Messenger user. It is cost-efficient as it saves both patients and LGUs from unnecessary expenses for transportation. It provides instant response and effectively manage patient at your fingertips. It handles common illnesses found in the community such as diarrhea, hypertension, cough, and other possible diseases based on clinical practice guidelines that can be integrated into the system's algorithm. It triages urgent versus non-urgent cases and will prompt the user to actively seek consult if it is an emergency. In addition, it can provide health facility information such as clinic schedules, essential contact numbers, and the availability of doctor in the rural health unit. Doc Adadayon provides health information and promotion that will help in bridging the gaps between the patient, education, and regards to health.
Teenage pregnancy is now considered a national social emergency because it may hinder young women's formal education, may compromise their future employment opportunities, and may lead to poor health outcomes. According to the Commission on Population and Development, the lack of access to comprehensive sexual education is one of the main causes for the high teenage pregnancy rates in our country. In addition, narratives from our community show that sex and reproductive health are still taboo topics because parents are quite embarrassed to discuss about these sensitive information to their children. Teenage parents still cite the lack of information regarding sex and contraceptive methods as one of the main reasons for their risky sexual behaviors leading to teenage pregnancy.
YOLO is an interactive, fun, educational offline game that produces comprehensive, medically accurate, age-appropriate sexual and reproductive health information in multiple languages. It's gender-sensitive, and features include dynamic text, graphics, self-assessment, and in-game dilemmas, which simulates real-life situations and dialogues regarding adolescence and sexuality. YOLO has 7 sections on core topics and subtopics of the comprehensive sexuality education, covering approximately 40 to 60 minutes of gameplay. In collaboration with numerous government and non-government organizations, YOLO will feature an option for players to talk to qualified counselors 24/7 regarding sexuality as well as mental health, or help navigate them to the nearest counselor. The game also provides answers to frequently asked questions regarding adolescent health, such as, pwede po bang mabuntis sa unang pagtatalik, among many others. YOLO may also be used as an alternative mode of education material, or it can be used as a complement to the existing CSEs in schools to make them a healthy, adolescent-friendly learning institution. It can be used to initiate discussion of sensitive topics which teachers and even parents or peers may be embarrassed to talk about.
We hope that YOLO can be integrated into the population-based services of the universal healthcare, highlighting the importance of creating healthy, adolescent-oriented learning environments in order to increase sexual health literacy in the youth and ultimately reduce teenage pregnancy. Let us remember that the youth is the next generation's beacon of hope. Hence, let's invest in our future by investing in YOLO. You only live once, let's make it right. Thank you. YOLO!
Program until tomorrow will be very fruitful also for you because I think you'll also be not only looking at the innovations that you are thinking of in your different areas, but also thinking about yourself.
You created solutions and dream and imagine for better things that we normally take for granted. Don't be afraid to test the water. Go out of the boundary, think out of the box, and create meaningful solutions. Because after all, at the end of the day, it's for the country. It's nation building. Not only that, you showed your confidence and your competence by applying some of the elements of transdisciplinary approach. And that is a hallmark of a good leader. And we saw that in you, in this batch, this cohort, and also the cohort last week.
You are the doctors that we are really proud of. Okay? The doctors that the Ateneo education should be producing. Okay? And we are very proud that you are out there doing your best for the country. We're here to support you. I hope that this is a continuing relationship between Ateneo and yourselves. I hope you always feel that you can come home to Ateneo. Our vision is to support our alumni as well, and you're part of that community.
I've never been in the same room with all of Dr. Tudabarios who are serving from Luzon, Visayas, and Mindanao. So thank you for serving our country, and hopefully with your education at the ASoG, rest assured you will be equipped in terms of competencies in public management, but most important, to be the leaders of the future and to be the trailblazers, if I should say, in change. Ang dami kailangan pagbabago sa bansa natin, and kayo yun. Kayo ang future na anak ni Yusek Mario for really implementing universal healthcare. Palakpakan naman natin ang mga Dr. Tudabarios.